The Premier isn't the only one copping flack today. There's more trouble for the embattled Health Minister, Gillian Skinner, who's now at odds with stroke experts. Doctors say lives would be saved if stroke specialists and support staff were rostered on overnight at state hospitals, as they are in other states. The Minister says it's not a major concern because surgery is not time critical. Zoe Ford reports.
A stroke spreads like a fire in the brain, and the longer it goes undetected, the more damage it can do.
Stroke is Australia's second biggest killer, and every minute counts when one strikes.
Time is critical, so call 000 straight away.
Today, Health Minister Gillian Skinner told ABC Radio she doesn't believe treatment is always as urgent.
It is not time critical, and there's much research that suggests that if you can wait till daylight hours, it's a much better outcome for patients, no matter what surgery.
This shows that the Premier should get us a new Health Minister. She is completely out of touch and insensitive to the needs of patients.
If it's a bleeding type of stroke, then yes, I would agree with the Minister, most of those could wait till the next morning. However, if it's a stroke where you've had a blocked vessel in your brain, and that's 85% of strokes, the vast majority, that is absolutely time critical.
Stroke patients initially receive a clot-busting drug, but serious cases require surgery known as thrombectomy to remove the clot.
It is such an enormous breakthrough. You know, it's the biggest thing I've seen in my medical career.
Interventional Neuroradiologist Dr. Jason Wenderoth and his colleagues are willing to work overnight, but hospitals aren't funded to help them.
I'm the guy who does a procedure, but I can't do a procedure without some very highly trained and skilled nursing staff and anaesthetists and radiographers and other people behind me.
New South Wales Health says surgery is only time critical for a small number of patients.
We're not talking about a single procedure. We are talking about a system of care for our patients to make sure that we get the very best outcomes.
It wants to recruit doctors from overseas and train them, but critics say that'll be more costly and insufficient for this highly specialised field. Zoe Ford, ABC News, Sydney.